Mrs. D is a 63-year-old female, presents with syncope. This is another very common admission you're going to see in the hospital. I guarantee you, I keep saying that, but I guarantee you this is another very common admission you're going to have in the hospital, syncope. You're going to have at least 1 or 2 patients on a weekly basis who just come in with syncope. She knows that she was having a bowel movement, and a lot of times it has something to do with the bathroom. And I'll tell you why it has to do something with the bathroom. So she was having a bowel movement. After standing up, she felt dizzy and passed out. Daughter rushed in. The patient did not hit her head. And this is very important for us to know, because if a patient hit their head, they need to get a CT scan of the head to make sure they don't have like a subdural hematoma or something like that. Did not lose urine or stool. No tongue biting. After she came back, was not confused. Denies chest pain, shortness of breath prior to this episode. How would you work up the patient's case, and what's the most likely diagnosis? So when you are admitting a patient, this is how you should present this patient. Every point here is a diagnosis. I tell you what I mean. So while she was having a bowel movement, that tells you the diagnosis. After standing up, this is another diagnosis. She felt dizzy and passed out. That are rushed in, the patient did not hit her head, did not lose urine or stool or tongue biting. That's another diagnosis. In fact, that's another algorithm that you need to go into. In patients who come in with syncope, you have to make sure to differentiate. Did this patient have syncope or did this patient have seizure? 2 different pathways. Seizure, increase in brain activity. Syncope is decrease in blood perfusion to the brain.